Hello, my name is Justin Nunez, and this is a medical assessment for EMS 105. This is my fiance, Savannah Markham. She's going to be my patient today, and she is going to be having an asthma attack. So, I get dispatched for a 22-year-old female who is having difficulty breathing. So, scene is safe. Um, I and since we're in the time of COVID, I'm going to be doing full body isolation because dispatch could not confirm or deny that they had any that they possibly have COVID. So I'm going to be doing the whole um, body isolation. So I'm going to be wearing a mask, a face shield, gown, gloves, the whole shabam. I'm going to be doing that today. And so I have one patient. This is going to be nature of illness since she's having difficulty breathing. Um, and since I am going to be a BLS unit, I am going to ask for paramedic assistance. So I'm going to have paramedicine or the ALS coming by since I'm only a BLS rig. And at this moment, since it is nature of illness, I'm not going to be doing anything C-spine. So as I walk up to the patient, she is obviously having difficulty breathing. She's kind of like hanging out. Well, not hanging out, but she's having difficulty breathing. And I can tell as I walk up to her and then I speak to her, she can see me. So she's alert and oriented to verbal. Um, Hello, ma'am. What's your name?
Savannah.
Do you know where you're at right now?
Home.
Home. Do you know what time of day it is?
It's midday. It's like noon.
Can you tell me what happened?
I was exercising and I got very short of breath and started having an asthma attack, started having chest pain, and I didn't have an inhaler on hand to ease my asthma attack.
Okay, so you have an inhaler. Um, you don't have any refills or anything like that?
No, I'm out right now.
You're out? Okay. Alright, well, based off of the information that she's already told me, her LOC is ×4, and she's alert and oriented to verbal. So at this moment, listening to her, I can hear that her airway isn't exactly clear since she is having some wheezing, and I did hear that as I was coming up. I heard wheezing. So I'm going to go ahead and take a listen to her four lobes on her lungs. We have up here, here, underneath the armpits or mid-axillary on both sides. And on the upper lobes, I can hear that there is wheezing. And then on the lower lobes, I can hear that it is diminished. So I'm going to go ahead and get her on some oxygen at 15 liters a minute. And I'm going to hold off on giving her any albuterol at this moment because I need to get some more history from her. And judging by her circulation, I'm going to go ahead and get a cap refill under 2 seconds. So we're good on that. Her skin is pale, cool, and clammy. So obviously she is still getting circulation, but she's not getting enough oxygen at this moment. So the skin's starting to try and compensate for that. So at this moment, this is a high priority patient. I'm going to be taking them straight to the hospital. If it's easier to go meet up with the ALS unit, I will be doing that, and I'll be making sure I can administer albuterol to this patient. So, can you tell me what happened or what you were doing to make this asthma attack come on again?
I was exercising and I just started having an asthma attack. I guess I did too much.
Does anything make it better?
Laying down or being seated in kind of a reclined position.
And what makes it worse?
Standing or moving.
Okay. How would you describe if you are experiencing any pain, how would you describe it?
Tightness of the chest, discomfort. It's not necessarily like pain or sharp pain, but it's tightness and thus difficulty breathing.
Okay, and does it spread anywhere else from just your chest? Does it radiate or extend to any other extremities or lower or anything like that?
No.
No? Okay. And if you had to rate this on a pain scale of 1 to 10, how would you rate it? 1 being the least amount of pain you've ever had, to 10 being the most amount of pain you've ever had. How would you rate it?
It's not pain, but the discomfort and difficulty breathing is a 7.
Okay, so mostly just discomfort, extremely just uncomfortable. Okay, and can you tell me again what you were doing?
I was exercising.
And how long ago was that?
About 30 minutes ago.
30 minutes ago, and that's when you decided to call EMS? Okay. Alrighty, well, are you allergic to anything?
I'm allergic to penicillin and lactose, and I have seasonal allergies,
Okay.
which is why I have an inhaler.
That is why you have an inhaler?
It's also because I have asthma.
Okay. Alright, so what happens when you have lactose or penicillin?
I go into anaphylaxis with both of them.
Is it severe, mild, moderate?
Penicillin is severe enough that I have to go to the hospital.
Okay.
Lactose is moderate. I can just take Benadryl at home and avoid having to go to the hospital.
And does it feel like you're having an anaphylactic reaction right now?
No.
No? What does it feel like you're having right now?
It's more like an asthma attack.
Asthma? Okay. So I know you said you were taking, you have an inhaler. What is the medication for that specifically?
The medications I'm on are Claritin, Xyzal, Novolog, and ProAir.
ProAir. So ProAir is the albuterol?
Yes.
And you take the Novolog for what?
I am a type 1 diabetic.
Okay. And have you taken your insulin today?
Yes.
Okay. Well, with this information, I'm going to go ahead and have my partner get a set of vitals before, we start leaving for the hospital. So my partner gets the vitals. They're going to get a blood pressure. They're going to get her heart rate, her respiratory rate. We're going to go ahead and get her SpO2 as well, blood sugar, and I've already also stated the lungs, so I know what the lungs are. Her glucose comes back in the normals, which is 113. Is that normal for you?
Yes.
Perfect. Your blood pressure is 122/90, so that's fine. Your heart rate is 110, but I do kind of expect that since you are having some anxiety because you are having difficulty breathing. So your heart's trying to compensate for that. Your respiratory rate is 24 beats or 24 breaths a minute, and her SpO2 on room air was 90%. So I've been giving her oxygen for right now, and at this moment, I'm also going to go ahead and give her some albuterol, 2.5 milligrams at 8 liters a minute. And we're going to go ahead, and since the non-rebreather mask can have the nebulizer equipment attached to it, we're going to go ahead and have her have a nebulizer mask. So then she doesn't have to hold it, and she can just focus on taking in the albuterol and breathing deep. And so as I'm giving you this albuterol, we're going to want to make sure we get it in nice and deep into your chest. You want to take nice deep breaths like you usually would for your inhaler. And at this moment, I'm just going to reassess after it's been about 5 minutes after I've given her these treatments. So I'm going to reassess and see what I've got. So at this moment, her ABC seemed to be improving. Her blood pressure was 124/94, so basically the same. Her her heart rate is a little bit higher, but that's to be expected with the albuterol, which albuterol will increase your heart rate, and it might give you a little bit of a headache. And her respiratory rate seems to be coming down. It's at about 18 beats per minute. And her glucose was 109, so it came down just a little bit, but she's using some energy right now, so that is to be expected. And her lungs, by listening to the 4 points again, I hear that the lung sounds have come back to the lower lows, and that the wheezing I heard earlier is not absent, it's diminished. So her wheezing has gotten better, but it's still there. So I possibly will be administering a second dose of albuterol. However, due to that I'm already at the hospital, I may just hold off on that. And for my report to the patient or to the hospital, as my partner's gonna go ahead and help me get them off from the gurney onto the bed, since they drove us here. As my partner is unhooking them from the gurney, getting them over, and making sure their oxygen and their mask is all good, and that everything I was using to check out her vitals is all set to the hospital. I'm going to let the hospital know that my impression of this patient is that she was having an asthma attack from some exercise today. And the reason why she had to call EMS was because she wasn't able to get a refill on her albuterol. So I had administered oxygen initially to her through a non-rebreather at 15 liters a minute. Her vitals at first, she had a high respiratory rate, and she also had a low SpO2. Her SpO2 after I had gone the second set of vitals was at 98% after receiving the treatment. So there is a marked improvement on that. She's also seems to be breathing better. Her color's coming back to her a little bit. She's looking really good. Um, and this patient was administered 2.5 milligrams of albuterol once. I held off a second dose because we had just arrived to the hospital. And this patient has allergies to penicillin and lactose, and those can cause anaphylactic in her. However, she's not experiencing those. She's also a type 1 diabetic. She has taken her insulin today, so she is good on that. And she also takes Claritin, Xyzal, Novolog, and ProAir. The Novolog is her insulin, the ProAir is her albuterol, and the Claritin and the Xyzal are her antihistamine since she has mast cell activation. Her history is that she has asthma, mast cell activation, and what was the last one? You also had seasonal allergies as well. And I did say type 1 diabetes. She has type 1 diabetes as well. And that is the end of my assessment. Thank you for watching. Again, my name is Justin Nunez. This is my fiance, Savannah Markham. Great patient. Thank you very much. Have a good day. Bye-bye.